interested and willing to share. So to start us off, we have Casey and Donna from Island Health. And Casey and Donna, I will be clicking through your slides for you, so you don't have to worry about that. But if you want to unmute your line, I will get us started.
Okay, well, hopefully everyone can hear us all right.
It's great.
So I'm Donna. Oh my gosh, I was going to say I was Donna. That's where my headspace is at. I'm Casey. I'm one of the RNs that works at Campbell River Diabetes Education Center. And to my right is Donna McCall, and she is our MOA. And of course, we have our manager, Heather Tant, who I believe is on the call with us today. So this is our little snapshot of how we've rolled out virtual health up in Campbell River. Next slide, please. Okay, so my favorite quote, in the middle of difficulty lies opportunity. And I don't know if there are more difficult situations we could be in terms of providing healthcare support for our clients and patients, but it has definitely been an interesting road that we've been on. And we have, as you guys can all see on the previous exercise, there have been lots of opportunities and there have been barriers, so it's been a pretty steep learning curve. So we just kind of wanted to give you an overview. Our team actually consists of 3 registered nurses, 1 dietitian, and Donna, who is our MOA, as well as a part-time MOA that we'll talk a little bit about kind of as we get through the slides. So I am actually a casual employee, and then we have Jackie and Monique, who are both full-time parts. Like one is 8.7, and Monique is our 0.4. So a couple of things, a couple strengths that they've brought, especially in this time, is being able to have some sort of idea and inkling in terms of predicting what we need to do in terms of supporting our people in this time. So things like really focusing on things that would be to avoid hypoglycemic events, hyperglycemia, DKA, sick day management, and teeing up with people that we thought were more kind of at risk for that. I've brought my strengths kind of, I'm new to the position, but the one thing that I have been able to do is to help out on the tech side in terms of getting everybody on board with Zoom and my virtual visit. So I've been able to troubleshoot a few things, and that's been great. Erin, who's our dietitian, she's been at the forefront of rolling out the care for our GDM clients and putting together pre-diabetes packages and providing that support in terms of getting people ahead of time and getting them the resources to kind of start with the process of learning what pre-diabetes is about, what GDM is about. And of course, Donna has been a superstar in all of this and has been constantly adapting to the different, strains, we could say, in terms of, changing the way that we're giving information, consent, setting up appointments, whether they're in Cerner or on the My Virtual Health platform. Also taking a lead role in helping out with Zoom and practicing our Zoom meetings with our team meetings every week. So that's been fantastic. And then Heather, our manager, has been a champion in terms of being able to provide us with the support in terms of giving us the okay for added hours to navigate all of this and become familiar with the different virtual platforms out there. As I'm sure most of you can attest, it's not necessarily an easy road to go through. There's lots of technical bumps, and so it does take time. It takes practice to get used to all of that. The next thing I wanted to talk about a little bit here is the idea of the devil is in the details. And again, this really speaks to how much we've really learned in terms of the process that we're using, how incredibly important communication is, adopting and adapting to technology, and I should have bolded and underlined and capitalized the preparation part of this. It does really speak to the idea that, if an appointment is going to go well, we need to be prepared for it, and that really has been one of the key points to this. The other thing that we wanted to talk about a little bit is kind of this idea of adapting to what type of appointment is coming up, right? So we all know that a GDM appointment will be very different than, say, a new diagnosis of type 2, which is, again, very different from a follow-up that's had type 1 diabetes for a number of years. So trying to find the right resources that really support those people moving forward. And Donna's done a great job in terms of working with the team to come up with the electronic versions of a lot of what we were talking about, like some of the Diabetes Canada handouts. We as well use On the Road to Diabetes Health, so I'm sure everybody across the province of BC should be getting that. So that's been an awesome success for us. We also found that setting up basically a folder to share all of this stuff in one central place has really served us well, and we've actually made subfolders in terms of kind of putting it in an easy to find place regardless of who you are and what you're working with. Yeah, so with respect to the technology side of things, one of the things that we've discovered, and again, I think we saw that in the exercise, was the idea that not everyone is comfortable with technology. And with diabetes, we've really kind of leaned on some of the technologies out there in terms of sharing blood glucoses and what that looks like for our clients and patients. So we've developed some how-to documents with screenshots to try to step-by-step, screen-by-screen, walk people through how to set up some of that technology so that we can really embrace that in terms of supporting their appointments with us, so we can see, you know, what sorts of doses of insulin that they're taking, what their blood sugars what their blood sugars have been, without devoting, you know, 10 minutes, 15 minutes of that phone call to simply dictating those numbers over the phone. So that's been a really good success for us. What we've also found is, you know, I think that before all of this, there were some perhaps preconceived notions about age and the ability to adapt to technology, and some concerns around, you know, our older population and whether or not we would be able to connect with them virtually. And we've actually had a pretty good success rate with that in terms of linking with some of our clients. I'm sure some of them could probably outmaneuver me on some of the virtual technology. You know, I have one that's, you know, I was talking to them on the phone and they're like, our next one should be on Zoom. I've got that down. My grandkids are on the phone. We're good. So that's been really interesting. And then the other thing that's been really interesting with that is that people that we've been working with where we've tried to connect them with technology before COVID hadn't been able to do it, and now, because I've been able to, one of the clients that we have coming for our pediatric clinic, I was able to walk them through screen by screen, and now they're connected virtually. So it's been a pretty phenomenal experience that way. Okay, I always have too much to talk about when we get into this type of thing. Okay, in terms of tips or tricks, I guess what we've learned is, especially with the vast amount of technology out there with pumps and different blood glucose meters and different apps, is get into them and play with them from a personal standpoint. So what I've done is you download the app on your phone and then you get in and you start playing with it and you practice sharing it with the clinic, and that gives you that insight from the client or the patient perspective. So maybe you can highlight those little tricky spots for them to be able to navigate it a little bit easier. One of the things that we found was with the OneTouch Reflect meter is that it has a blood glucose mentor, which we sort of knew about, but we were kind of like, we didn't really dive into it too much. And then our GDM, a couple of our GDM clients actually gave us some feedback that when we had set their blood glucose ranges, is lo and behold, if they were a 5.0, they were being told to drink juice because they were low because they had this blood glucose monitor on. So again, having that trust and that relationship with your clients and asking them for the feedback to say, hey, what is working? Have you noticed any glitches? Have there been any problems? Has been good. And, you know, in terms of the administration piece, I think Donna can speak really well to kind of, from her perspective, what's worked well and what's been challenging, because she's done an amazing job with it, for sure.
Yeah, so there have been several glitches, but like Casey said, we've had lots of successes as well. And I think the communication piece in our team is so great in that we all work in collaboration spaces. So for myself, I work in a collaboration space with 5 or 6 other MOAs. So even though we're not listening to everybody else's work, when something goes well or something goes poorly, we're all learning it at the same time. As such, with the clinician spaces as well, all the clinicians have collaboration spaces that they collaborate, and we work through these things. And it's not like you're recreating the wheel every time. Somebody maybe has already figured this out, and we're collaborating all the time and communicating by uploading all the most recent forms that we had to shift fairly quickly to fillable forms so that they can all be filled out online and such. So we've had a really good success with that. I don't know what else. But just celebrating and supporting each other, because each of us bring a unique ability and skill to the team, and our team is really great at doing that. So.
Yeah. Okay, so plan for the worst and hope for the best. What we've learned in that respect is no matter how much preparation, how much planning, you dot your I's, you cross your T's, things can go sideways. For instance, we had a recent pump start done virtually, and the screen kept freezing. So what do, right? So there's those kind of things, and I think what we've gone to is that idea that you try to troubleshoot. If you're in the middle of an appointment and it's just not going well, abandon ship. Let's go back to a telephone call. Say, you know what, it's just not working this time. Let's go do what we can on a phone call. If it's something that requires kind of that face-to-face interaction, then seeing, can we do it virtually, or is this one of those situations that it's urgent need? Let's bring them into clinic. The risk justifies the overall benefit in those scenarios. So I think and that really ties well into this idea of flexibility and adapting, right? We all need to kind of think on our feet and adapt to what is that's happening right in front of us. So we do have our first, I would say, legitimate virtual pediatric clinic coming up this week. So we do have a doctor in Campbell River that has kind of come on to site for the last couple, but this one that we have coming up at the end of the week, our pediatric endo is in Vancouver, and we're going to be here, and the clients are going to be at home. So we've set it up with Zoom, and we've done everything we can to make it run smoothly, and my fingers are crossed. I think we're all knocking on wood. That'll go well. But again, if it doesn't, then we have those contingencies in place, and we're able to be flexible and adapting in that situation as it comes up. So, okay. Maybe we'll go to the next slide then, because I am mindful I don't want to take up all of your time. Like I said, leveraging the technology has been a huge headache and a huge benefit. So I think it is, again, when we're looking at everything that's out there in terms of supporting us, I do know that there's always been some concerns around privacy in terms of when we're looking at cloud technology and those types of things. But when you're in these unique situations of really needing to lean on technology, it's kind of adapting, right, and figuring out what works. And we use a lot of LibreView. We've used the Dexcom Clarity app. We've been getting clients to download Diasend onto their home computers, and using apps like the Reveal app in order for clients to seamlessly share their data. A lot of clients are finding that it's exciting. They don't have to worry about emailing pictures of logbooks. They can actually just set this stuff up, forget it, and know that we'll get it without us hounding them. So, all right, next slide. So that's lovely me. This is kind of, I just wanted to put this up there to show you that Zoom has actually been a really good platform. Our virtual, over in Island Health, we're using My Virtual Visit, but because it rolled out so incredibly fast, there's been a few glitches specifically for kind of the scenario we're looking at for this Thursday-Friday clinic, in that we can't have more than 2 people in a room at a time. So we set up our pediatric clinic with Zoom, and we had the help of Vancouver Coastal Health. One of the clinics down there gave us a little kind of crash course on how to do this. But basically what we did was each client for these pediatric clinics are set up with their own breakout room. So they're coming into the general waiting room, we connect with them, and then we move them into their independent breakout room. And this is where the clinician and our endo will meet with them, and then we can go seamlessly from each client to the next without restarting and starting meetings. So it makes it a lot easier. It's also a little bit easier for booking because we don't have to send out individual invites. It's just one link that sends them over. So that was a fun one to figure out because I think we were on the phone on Friday afternoon for about 2.5 hours doing a mock clinic so that we all knew kind of where the buttons were, how to invite people, because we have a couple clients that preferred to do it via phone. So instead of having them call in, which can be a little bit problematic, we simply call them. So we practiced that. So that was our experience with that. Okay, next slide, please. I'm just about done, I promise. So as I mentioned, over on Island Health, we're using the platform My Virtual Visit. Again, rolled out super fast, and there were definitely hiccups. And a lot of people noted this kind of in our little exercise there. One of them seemed to be bandwidth. So having audio problems, having videos freeze, those types of things. We service a lot of remote areas. So we're covering Port Hardy, Port McNeil, over to Powell River, Taskus, Gold River, all of these smaller communities that don't necessarily have the internet capacity to deal with this. So that was an interesting one. We've also come across hiccups in terms of scheduling. So that's been interesting to overcome. And again, you know, that idea of ease and comfort of technology with the practitioners and the clients. So again, adapting in the moment, knowing it's just not going well. Let's go back to something we know. Trickier problem shooting. There was a little bit of magic trick around the audio, but we figured it out. But it did take Donna a week of talking with our IT people. They still couldn't figure it out, and only because my partner is technologically advanced and has taught me some things along the way, we were able to kind of troubleshoot it and get it working. But it was a headache, a little bit stressful. Eventually, what we're hoping for is integration into electronic charting, which will be fantastic, but it's not there yet. All right. I guess the last thing that I would like to talk about a little bit here is the, you know, what does this look like going forward, right? So I'm just going to fix that. So historically, I think most of us could agree that it has been clinic appointments. People have to travel. Appointments tend to be a little bit longer, less frequently due to that undertaking. And what does it look like for the future? So for those people that have clients in really remote areas, this may be an opportunity to reach out on a more regular basis. We can have shorter and more frequent check-ins, right? It's a quick 5-minute call or 10-minute call, opportunity to increase the client's engagement through leveraging technology. So what we're doing a lot more is teaching them, you know, let's pull up that Clarity account report. Let's talk about it on the screen as we're going through it to see what your blood sugars are doing. So there's been a huge advantage there. And like some of you are already ahead of the ball game and doing classes. We haven't quite rolled that out yet, but it's certainly on the horizon. And, you know, virtual versus telephone, we're really able to kind of cue in on those body language cues now more so than you're on the phone, and I think that's a huge advantage. And I'm going to stop talking now because I know I'm way too fast. So, Donna, did you have anything else to add? I know I kind of took over there.
No, I think you pretty much covered most of the things. I know we've been working hard through this whole thing to continue to meet the provincial standards and having to all these different spreadsheets and reporting tools and stuff so that we can, you know, chart all this uncharted territory, I guess is what it says, to help us advocate for supports and just the importance of capturing all this during stats and reporting. And, you know, we've just recently added wait lists to our Cerner books where we never really had that before. So lots of positive changes have come out of this pandemic, but certainly, you know, lots of challenges too, and I'm just so proud to be part of the amazing team here that we have, led by our manager, Heather Tant, to keep us supporting and working to the best of our abilities to support the most vulnerable, one of the most vulnerable clients within, the scope of healthcare. I mean, diabetes is a huge condition that many people have, and our clinic supports gestational peds, the acute teams, the type 1s and 2s. We, do so many things with pump starts and group education, and it's just really important work that I'm happy to be a part of. So thank you, Casey, for all your work on this presentation. Yes.
Wow. Yes, thank you both. That was so great. It's really insightful to hear everything that you guys have gone through, and I'm sure others can relate. You have a couple comments in the chat I see just around how impressive it is, how much you're making this work for your patients, and as well as integrating the apps that you have, increasing client engagement by leveraging technology. Yes, so you're some excitement there, and yeah, again, really highlighting the proud, like Heather is commenting, just how proud she is, and we're getting that sense of pride across the province, so that's wonderful. So I am conscious of time, so how about we give it like 2 minutes for questions? Does anyone, so there's multiple ways to ask questions. You can pop it into the chat if you'd like. You can raise your hand and Shauna can unmute your line if you'd like to speak, or you can use your text tool to pop your question on the screen. So I see a question here from Jessica. How have you found older adults using the new apps?
Actually, I would say it's about maybe 50-50. I think a lot of older adults are actually doing quite well with it. What I have found in my practice is they tend to do much better if you have them on the line and you talk through them screen by screen. Once they have it set up and they're used to it, they seem to be a little bit more comfortable with it. But yeah, it's surprising. I know that that was one of the concerns moving forward, but a lot of our older adults are very tech savvy. They're talking to their grandkids on iPhones and Zoom and FaceTime, so it's not that big of a jump. Whereas, I know one of the challenges has been kind of these less known apps, like with our My Virtual Visit. We have had a couple of hiccups with that, but that's kind of been in the works for resolving because of just the technology that they use. The platform was originally just a browser, and we were having some connectivity with that, so then it was downloading an app, and that was a little bit trickier. So hit and miss.
Yeah, for sure. Yeah, and Heather is just adding to that. That's great. Yeah, just some thank you messages. So in the interest of time, we will have another Q&A question, so we can always link back to you. That was so wonderful. So thank you both, Donna and Casey, for sharing. And so next up, we're going to get to Providence Health and Melody. So Melody, again, I will advance your slides for you, and you are set.
Oh, can you hear me now? I was pressing the wrong button.
Yes.
So I won't take that long because I feel like Casey and Donna kind of gave all the information. I'm going to basically be repeating this information, so thank you for that. So yeah, you can go to the next slide. So really, I'm going to just talk about kind of what happened from the beginning to kind of where we are right now. So that dreadful day in March, we kind of got that directive from our operations leader that, we have to cancel all non-essential appointments in the ambulatory clinic. So basically, we had to hold all classes until further notice, basically start prioritizing our patients. And the directive was to see the ones, obviously, who have the deteriorating health to be seen in person. So basically, we got our slates for like the next month and a half and triaged every patient to see, who do we need to see immediately. And, as we were going through it, we found that there were not quite that many that we had to see right away. But again, we did get that few that went in. The next step to that was just kind of setting up our workspace. So we all had to have our own room and make sure that we had the proper telephone and computer access. And so, like Casey was saying, you know, it was kind of quick how quickly we were all able to adapt. So we all quickly learned to basically provide patient care to the telephone within 2 to 3 days. So we didn't just, you know, stick our foot into the water to check the temperature. We actually all just jumped right in. So yeah, next slide. So what happened? Basically, we just started doing all telephone visits because at first we didn't kind of have this information about Zoom or any kind of online applications available. We did have a few like the Skype Business, but of course none of us were using that, so none of us knew exactly how to do anything. So we just kind of went straight to telephone visits. So we basically did it the exact same way. Nothing really changed except everything was on the phone. So the long version of it is that we, you know, nurse had to call the patient, then the dietitian, and then the doctor. So it was kind of 3 separate calls that they were receiving. And we aren't on any sort of online charting yet. So basically everything was paper. So we're basically handing the charts around. So it was a bit of a mess at first, but eventually we got used to it. And then about a few days later, we found out that we had the Zoom account that we were able to sign up for. So I basically emailed all the reps, all the glucose meter reps, OneTouch, Accu-Check, ContourNext, the Libre Views, Dexcom, all the medication reps, all the insulin pump reps, and I asked for, you know, them to send me all the available resources they have online, any videos to help them teach, you know, how can we teach patients. And they did wonderful. And I got email after email after email. And so now we have this kind of 1-page document that has all this information for us to kind of access for our patients, referring them to the online website, and then we can send them to the patients. We also created 1 generic email account with a no reply so that we're not sending it from our personal email. And so whenever we had anybody to send that to, then we could just send this email. And we all got to see who was sending the information. So if, you know, anyone replied to this no reply email, we all knew what was happening and who sent the email. So so it's kind of good. So we all had this shared email account. And then, like I said, we got that licensed Zoom account. So we all started applying for it and immediately started working on our sessions. We're normally a 2-part education session that's at least 2.5 hours to 3 hours depending, and we knew that, you know, being at home, you probably don't want to be sitting online for that long, so we decided to kind of just strengthen it and shorten it to see, you know, to talk more about what needs to be discussed at that time. Yeah, next slide. And so our successes, and I don't want to say failures, I want to say that we're working on it, because this whole process is a working on it. So despite the fact that we didn't work, I still think it wasn't a failure. I think it was like, okay, well, what do we need to do then, right? What do we need to work on? So telephone visits was kind of where people, as for telephone visits, sorry, people loved it. They absolutely loved it. You know, it was a less commute. We are located downtown Vancouver, so, you know, it was hassle-free parking, despite the fact that, you know, now there was free parking everywhere. Even our hospital had free parking for patients, but still, again, we weren't encouraging anyone to go out, so, you know, it's a less commute for them to come in. Our no-show rate immediately went down because now we were able to connect with people through the phone because obviously everybody was at home, so that was really good. Our endocrinologists, as you know, we are on Cerner now, so they are all kind of on that page, so they were able to work from home, and it changed from having the nurse and dietitian assess the patient to having the doctor assess and then being like, okay, you need further discussion with the nurse and dietitian, which worked actually really well because then we spent more time with the patient. It just became more of a one-to-one appointment rather than this quick assessment, you got to see the endo, right? So it was the endo who kind of talked to us and was like, yeah, this needs more education on this, needs that, and so we were able to do that. And then again, like Casey was saying, or you guys are saying, it worked really well with the gestational population. They have so many appointments to go to, so doing everything over the phone or online made things a lot easier. As for our working on it, we became IT. So we were really helping people navigate their devices, especially, you know, their meters. Especially if they weren't logging it. So, you know, we had to have kind of that talking them through on how to work their meters and how to find their numbers or their logbooks. But then that's where getting all that information from the reps really helped, because we're able to either email it to them or send them a mail letter on how to use the devices. So that really helps. Another thing was the fear of people leaving their homes. So despite the fact that we're doing all these insulin starts, meter teaches, when we would follow up, nobody was doing anything. Oh, I didn't get my insulin yet, so I haven't done it because I'm too afraid to go to the pharmacy. Meters, same thing. They haven't gotten their meter because they don't want to go out. But the good thing about the meters is that, I don't know if any of you know, a lot of companies now are able to, you can sign up online for a meter and they'll send it to their home. So again, that's one of the resources that I was able to get from the meter companies. We were seeing higher blood sugars because of no exercise. People are fearing to go outside. And then again, the whole blood work, you know, numbers weren't being, we didn't know how things were going, if they were really going well or not. But what we did find was people were eating better. So it was kind of a 50-50. People were eating better or not eating better. So, and then the kind of, I don't want to say failure again, we're working on it, is the interpreter services. So the problem with that one is the billing was by minute, and then the connection was kind of really confusing because we had to contact the non-English speaking patient first to tell them to wait by their phone for interpreter services to connect. And then it was the interpreter service who had to connect us, which was backwards because they don't speak English. So it was really hard to say, wait by your phone. So I'd have to say interpreter services didn't work so well because then patient wouldn't somehow pick up the phone afterwards, or something would just go on and we would end up not seeing the patient. So that's kind of how we were trying to work with that one. All right, next slide. For our online session, the classes worked great. Again, everyone was in the comfort of their own home for classes. Again, same thing, gestational classes was a huge benefit. Same with the pump patients. What else am I saying here? Yeah, the elderly patients, again, they were all already on it, so that was really great. So they knew how to use it, but then again, there are some patients, the elderly patients, who just didn't use a phone or had one of the newer phones. So that was kind of what we had to work on. For the working on it, it became a huge learning curve, especially with Zoom. None of us had used it. I guess only a few of us have used it with our kids maybe, but otherwise we had to do a lot of mock kind of sessions on trying how to figure out how to use it, how to send invites out. Again, changing our education sessions so that it's more conducive to the 2-hour learning session that we're trying to keep it at. Another big thing was the privacy concerns that a lot of patients had. And, you know, we really had to talk to Zoom, and our Zoom people, we call them our Zoom experts, and they actually built a website for us on our kind of, I guess, internal health website that has kind of information about our program, about our Zoom. So one of them was that it's a licensed account. Another thing was ensuring that patients were using their own personal computer, and again, making sure that there are on the online privacy documents that we had that we could provide to patients if they wanted to know more about how we're keeping everything secure. And then the kind of failure, not failure, working on it is that we later found out that we were all unable to use our own desktop for Zoom because it actually slowed down the whole hospital internet system because everyone obviously went on it. So that's basically what happened. From then on, we only ended up with the one laptop, and we were able to get a Wi-Fi hotspot, which our IT team provided with us, and they encouraged us to use our own cell phones, which again was kind of like, well, that defeats the whole privacy as it would be our own cell phone. So again, we only found that we had one laptop. All right, next. So now we are in the new normal. We are in the COVID-19 recovery phase 2. So basically, we working kind of document came out for the ambulatory clinic from Public Health and Infection Control on how to see patients and allow them to start coming in. So our guidelines were for patients and clients is that we're allowing 40% in-person visits. We are again triaging the patients. Unfortunately, still no class or group sessions. We were highly encouraging to continue with telehealth and virtual visits as much as we could. And again, there was a script to assess patients before and of course when arriving for their appointments to ensure they did not have any COVID symptoms. As for staff, we had our personal protective equipment recommendations during the visits and how to do assessments, and again, how to use the equipment and the changing our environment. So basically assessing and setting up any precautions from the moment they enter the clinic to the very end. So as I don't know, I thought I could see these pictures bigger, but I guess not. So as you can see our waiting area now, we have spacing between all the chairs. We have little foot stickers placing where people can stand, and then our offices are taped. I guess you can't see the green line, so the patient sits at the very end of the wall while we are in the middle of the desk there. So, yeah, next page. My last slide. So again, our successes and again, our working on it. So we are 2 weeks now, almost 3, I think, into our recovery phase. So our successes, again, endocrinologists are loving it still, that they're seeing patients through the phone. They can work in the comfort of their own home. So what we have done actually instead is the endocrinologists are the ones triaging the need for the patient to come in instead. We're trying to follow the guidelines of trying to keep everything virtual health, telehealth visits. We are currently now slotting in more class sessions via Zoom. So we're able to offer it 3 times a month versus just the 1 time a month that we used to do it. And again, it's better for the gestational patients. And then, of course, our working on it features, basically, there are still patients that still want the in-person sessions. So now we're working on what is the next step, what's going to happen. So we do have a classroom here, so we're preparing for in-person classes. So we're trying to see how can we do this with spreading out the desks for a maximum of 6 people in a group session. We're currently working on if we plan on having these classes and more people in, we're doing kind of a checking, how do we check patients in without them coming into the waiting area, so kind of a check service. So we're working on that right now. And because everything was through Zoom through our one laptop, we had decided to purchase more tablets. So more devices to use for our Zoom sessions so that it's not just one person who's able to do a session over the laptop. And as we move forward, we are going, I believe we're in October we'll be on Cerner, so that may make things easier working from home if it comes to that point that we can work from home. Oh, and I lost you guys. And that's it.
Wow. Thank you so much, Melody. That was great. Both presentations were just great, so much information, and there's quite a few questions. There's quite a few questions. So I'm thinking in the interest of time, just because we do just have 3 minutes left, is it okay if we send you the questions and we share the responses that you have? Some are about sharing resources and then some specifics. If we share it in our follow-up email next week, would that work for you, Melody?
Sure, yeah, we could do that.
Okay, thank you. That was so valuable. So thank you both, Casey, Donna, and Melody for sharing. That, you know, like for me, it's been so much learning in this last half an hour or so. So thank you both, all three of you. I will do a quick wrap up. So yeah, so our first thing we'd like to do, and Shauna, you can grab the host. Yeah, so we'd like to know what you guys would like to see next time. There is going to be a poll that pops up in the bottom right-hand corner. If you could take a minute just to pick what you'd like to see next session as well as the sessions after that. Do you want to continue along this kind of going virtual with diabetes education train that we're on? We had some suggestions last time as well. So these are kind of the themes that we saw suggested to us last time. So one being diabetes education for special populations, remote rural locations, a session just on sharing resources, specifically around online tools, and then there was also the suggestion around a patient's perspective of going virtual. And then question number 4 will give you the opportunity to type in any answer that you'd like. So we will keep that open, and maybe we could just go to the next slide, and while people are answering the poll, I will just summarize. So I will try to be very quick. I took notes just in terms of what we heard today, and I think I'll start off with the same thing we heard last time, just around that sense of pride in teams and in clients, surprising us and being very tech-savvy and also willing to participate. The importance of process, preparation, and adaptability. Adaptability, I think, being huge as we leverage and learn new technology. I think both Melody and Casey highlighted that, as well as the importance of online resources. So as we said last time, we are committed to bringing this group together, and we heard that overwhelming interest last time as well as from the attendance today. So we are committed to bringing this group together, staying connected as we enter this new normal and beyond that. So I'm going to kind of speed up this and close with an evaluation poll. So we could close the poll on the next topics, and we will communicate what the results are in an email, follow-up email that will be sent next week along with the webinar recording. Shauna, if you could just go to the last slide. And so the next poll that will pop up as you exit the session will just be an evaluation poll to let us know what you think. We do review that quite extensively. So please take a minute and let us know how we can improve for future sessions and what you liked about this session. And really just thank you all to our presenters and to all of our attendees for attending. Thank you so much for making the time. And we will see you again soon. Thank you.